we've been hearing, a lot about this vaccine being worked on. We heard that it was going to take a certain amount of time, and now all of a sudden, as of now, it is here. It's ready to go and being shipped out all over the place. Can you guys please give us, give us some insight into what is the situation with the vaccines? Do we trust the vaccines? What can we look forward to with this? Is it similar to a flu shot? How they, put a little bit of the virus in you so you can fight it? Give us some insight, please.
Yeah, so I love talking about vaccines. I think vaccines are super fascinating, and this one is especially fascinating. The way that all vaccines work is kind of the same. They all basically tell our body, kind of send a warning signal to our body so that when we see an infection, our body can fight it off. That's how the flu vaccine works and all the vaccines that we're familiar with. This vaccine, the Pfizer vaccine that's recently been approved and is being shipped all over the country today, and the Moderna vaccine, which is also going to be approved probably this week or next week and start being shipped out, work on a technology which is, it's new in the sense that there haven't been vaccines manufactured until now using this technology, but the technology has been around and they've been working on it for years. And it's called messenger RNA. And RNA is part of the genetic code of everything. Viruses have genetic code, we have genetic code. And basically what this vaccine does is it sends a signal to our immune cells, kind of like a Snapchat message. So it sends a signal to our immune cells saying, if you see something that looks like this, kill it. And then like a Snapchat message, the messenger RNA disappears. But what it tells our immune cells is watch out for this spike protein. And if you've seen the pictures of the virus, it's got those little spikes all over it. It's like a little ball with these little spikes coming out. And those spikes it's made of a protein. It's very unique to this coronavirus. And the messenger RNA sends this seek and kill message into our immune cells, which we then carry around until at some point, if we get exposed to the virus, our immune system goes to work and fights it off before we can get sick. One thing that some people may not know is one of the inventors of this technology is a young black scientist named Kizzy Corbett. She's 34 years old. She's a brilliant molecular virology scientist. She works in Washington, D.C., and she is amazing. And she's really taken it upon herself to try to educate people about the vaccines as a Black woman, as someone from a group that has been disproportionately impacted by COVID death. So if you want to look up Kizzy Corbett, she's got a great channel on Instagram and she does a lot of educational pieces on there. So definitely worth a follow.
All right. Yeah, I definitely took note of her name. I'm going to definitely be looking her up. And that's interesting. It's kind of funny to hear you use the term or, compare it to Snapchat. Like, Dr. Jill, what do you know about Snapchat?
Dr. Joe, what do you know about that?
But that was a great comparison. It really gave me a visual of what it's actually doing. Dr. Taylor, you got some insight to add to that?
Yeah, I like the Snapchat analogy and the seek and kill. It's a very, very apt description, I think, of how vaccines do work. The other thing that I would add, other couple things I'd add about the vaccine that I've already heard from a few barbers and even some other people who've been texting and asking me about whether or not I'm going to get the vaccine and how it was developed, was just to let people know the peer-reviewed paper that came out in basically in medicine's kind of most trusted journal, the New England Journal of Medicine, was just came out a few days ago on Friday. And what I found was interesting about it was that the vaccine was actually tested on 43,000 people in the US, Argentina, Brazil, South Africa, Germany, and Turkey. So it's a pretty big population of people. Um, Over 70% of the participants came from the United States, and actually 9% of the participants in this particular vaccine study identified as Black. So we actually do have a large sample of people that this was tested on. And it did include a good number of Black folks in it. And as Jill mentioned, one of the main people behind the developing the vaccine was, a young African American woman who is advocating for this type of intervention. The vaccine so far that we've seen is very effective, about 95% effective in terms of actually preventing severe COVID disease. And from what I'm seeing, it is very safe. I do know that and acknowledge that we only have 2 months of data, and usually we like to see months to years of data to see if it's safe or not. But from what I have seen, it looks very safe. I will say, and I think it's important that people do know, that local reactions to the vaccine are very common. So things like a sore arm, things like fever, things like body aches were common with this vaccine, and they think actually that's our body telling us that it is working against and it's producing the machinery to fight off COVID. And that's why they think it is so effective. In fact, it's because it does cause quite a robust response from our bodies. So I do want to get that message out there to people that we will be hearing that people have a reaction to this vaccine, and that's actually expected. And that's a part of the process of making sure that it works. It doesn't mean, though, that it's dangerous or that it's not doing what it's supposed to be doing. Because the most common long-term side effect or effect, I will say, of the vaccine is protection against COVID.
This is one of those things that a lot of people could potentially be on the fence about when it comes to actually, getting a vaccine. Being that we are, all about the health of the community in the barbershop, how can we encourage our clients and also educate our clients on the vaccine?
Well, I think this is the most important question. There's been a lot of celebrities talking about how they're going to get the vaccine. Barack Obama is going to get the vaccine on TV, and that's great. I'm happy he's going to get vaccinated, but I think what's going to really make a difference in our communities is people like you, Jamal, people in the barbershops talking with their clients about why they trust the vaccine, why they're going to get the vaccine, and helping correct some of the misinformation that's out there. That's really what's going to make a difference. And, we've got an example of this with the flu shot. I know we've talked about flu shots before. Flu shots are important. They, thousands of people die from the flu every year. Right now, that seems kind of quaint compared to the 300,000 plus that have died from COVID. But flu is going to continue to kill people, and getting a flu vaccine is a great way to protect not only yourself, but your loved ones. Because if you, for example, Jamal, if you get the flu, you're not going to, most likely you're not going to die from it. It's not going to, you're healthy, you're young, you're going to have a miserable week, and then you're going to be fine. But you could pass that on to an older client or an older family member or someone who's not in great health, and they could die from the flu. So when you get vaccinated, you protect not only yourself, but all of your clients and all of your loved ones. And the same is true for the COVID vaccine. The stakes are a lot higher because so many more people are dying from COVID. It's a much more vicious illness than the flu that we see every year. So I think talking with people, letting them know that their questions are important, hearing them out. A lot of people, especially Black folks, have been treated poorly by our healthcare system. and don't have a lot of reason to trust that this is going to be a good thing for them. So just keeping the conversations going, and then getting the vaccine yourself and being able to share that information with folks is probably one of the most important things that you can do.
All right, leading by example. Lead by example. Thank you so much for that. Dr. Tyler, did you have anything to add to that?
No, I couldn't agree.
Taylor, I'm sorry.
Oh,
Dr. Tyler, Dr. Taylor, I'm sorry.
I couldn't agree more with Dr. Jill's sentiments. I think it is great that there's going to be vaccine campaigns and prominent people being public about their own vaccination. But I really do see barbers and community folks out there as the leaders in really getting the education out there. Getting informed yourself and being willing to have that conversation with people is the most powerful thing I think we can do. And, frankly, people are going to have those conversations with you, just as they have other sensitive conversations in the barbershops. And I think the education, the experience, and, that connection to the healthcare system, for that matter, is a really powerful way to get the word out and have people really open up about those things.
Absolutely. I agree with you guys 100%. This is nothing to play with. You know what I mean? And this is another time, as we've seen in 2020, opportunities for us to stand up and protect each other. And this is one of those times as well. And so in the barbershop, we want to make a commitment as professional barbers to make sure that we, educate our clients on this vaccine, also the virus, of course, but the vaccine as well, and encourage people, to make that choice. Because it's not only going to protect them, but it's going to protect those around them as well. So, this was very insightful. Appreciate the both of you guys immensely. Both of the programs that are in place, the custom checks program and the custom hypertension program, are huge, very impactful across the country. So thank you guys for the knowledge and the efforts that you put forth to make sure that we all are educated, on our health